Hey gang, I get coaching calls obviously from clients all the time. And a couple of weeks ago, I got a call from one of our clients, Dr. Scott Ihrig, and he said, "You know what? I need more new patients." And the way Elite works, man, if you just follow the systems, you get referrals. But some people, it's all in their mindset, right? It's all in mindset because how many times have we been taught in chiropractic? They don't use these words, but we're just trying to get a patient. We're trying to create another patient rather than having the mindset of not creating another patient, but we're creating a chiropractic leader. That means we're really responsible for everybody in their circle of influence. Now, here's the problem. The problem is you could say, yeah, I know, but really, do you get consistent referrals on day one? Are referrals on day one, just the way you process a patient on day one and day two, getting you consistent referrals, not a referral every now and then, but consistent referrals. So, hey, we have I've studied human behavior for 20 years, right? So we have it all set up. So you're getting multiple agreements, you're using body language, you're pacing, you're doing all these things. But the way you teach them, it's not through patient education. It's through changing belief systems. Now, when you want to create a leader and you want to, look at this Italian, and you want to change their belief systems, they automatically refer. So when you're going through a consultation, and you may address the pain, but you're not focused on it. You're focused on overall health. You're focused on the organ problems. And then anytime, and because we're postural and spinal corrective, when you're talking about organ problems, anytime they have something as a kid, before you even walk in there, you're looking and you see they're married and they have 3 kids. So if you're getting a history, hey, I had allergies as a kid, the first thing I'd say, well, after you reframe, you've had allergies your whole life, so your immune system's never been strong, right? And you get the agreement on that. Then I'd say, I know you have 3 kids. You probably have at least one of your kids that's following that same postural pattern that has a weakened immune system. Which one of your kids has allergies? That's going to be a fact. Okay, well, maybe they don't have allergies. Which one has ear infections? Which one has asthma? There's one of your children, at least one of them has signs of a weakened immune system. Boom, right there. You say that with certainty. Wow, my son has allergies. You know what? My daughter has asthma. Okay, they're probably developing the same patterns that you do. Boom, immediately a referral. When you get into the exam or in the consultation, when you're still doing the consultation, hey, which one of your brothers or sisters or someone else in your family that has hypoglycemia or is diabetic like you are? Hey, your uncle that has diabetes, maybe mimicking the same postural pattern. So the point is you shouldn't have to ask for referrals. It's the way you teach them. It's the way you change their beliefs that they begin to see patterns in themselves and in their family that automatically changes. When you're looking at their posture in exam, their kids have that posture. Their parents has their posture. Someone else, their brothers and sisters have that same posture. Their aunts and uncles have posture. So you immediately start with their immediate family and then extended family. What's immediate family? Husband, kids, wife, kids. What's extended family? Brothers, sisters, grandparents, parents, aunts, uncles, cousins, right? So when that becomes a normal part of your system, then you build your practice automatically. So we went through this 2 weeks ago with Dr. Scott Ihrig. In the last 2 weeks, he's increased his new patients. This is above and beyond 6 to 7 more new patients because all he did was change his vision from creating a chiropractic patient, which is what? A transactional relationship. Hey, just want to get you started. Just let's get you prepay the first visit, into creating a leader, creating a believer, looking at their circle of influence immediately because of the principle of being more concerned about their whole family, not just them. You have one person in there with a message that can change their whole family for generations to come. Is that your focus before you even walk in to do a pre-consult, shake their hand, or do a consult? When you and your team have that mindset, and it's based on lifetime, the amount of new patients and families that you're going to see is going to go up drastically. Now, we're on Facebook, we're on social media. So there's a bunch of people I know just on following me personally. Chiropractic, your spine and nervous system are the foundation of health and life in the body. Brain, spinal cord, sends energy to all the organs. That determines your health. This is a healthcare system. It's not about back pain. So if you want to keep your family healthy, then go see a chiropractor. Find a great chiropractor and make sure that they do spinal correction and make sure that they can take care of you and your family, change the way you live, and give you all a better life. For chiropractors out there, then you know this message is for families. Bring it to families, and I just gave you the system of how to enlighten your patients to want to help their family, be a leader in their family, and make a bigger change so we can change this world. So there you go. How cool is that? So let's take that purpose to another level. Here's a way to not only build your practice, but make a bigger impact in more families in your community and beyond. All right, you guys, thanks.